Hey folks, welcome back to the channel. Dr. Walker again, talking a little about flu and flu-like symptoms. And a lot of folks have been going through some significant disorder when it comes to the flu or just feeling unwell the last couple of months, and no one seems to really know why it's doing this. A lot of folks have had the flu shot, right? But whether or not that helps, I don't know. I don't know. But some people also suggest looking to the skies to see what is above our heads most of the day, and it may or may not be a part of this whole thing. But I digress. Let's get back to this thing. So, Dr. Zelenko's protocol is what I use, um, and Zelenko, he started his protocol back in back when I knew about it was in 2020, right after the pandemic started. And he suggested using these couple of things. And he talked zinc, vitamin C, quercetin, and D3, his protocol essentially. So the zinc, I take zinc bisglycinate. Bisglycinate I like now because I used to take gluconate, and gluconate can cause some belly pain, especially when you take it without food. Glycinate is a whole lot easier on the gut. Then you have quercetin. In fact, quercetin is the thing that he suggests you should take with the zinc. And quercetin, Quercetin, it's a pineapple extract. It helps to transport the zinc from outside the cell to inside the cell, where zinc, once inside the cell, becomes pretty lethal to viral processes. Vitamin C, and before we get too far into vitamin C should not be confused with ascorbic acid. Ascorbic acid is the shell, or one part of the complex of vitamin C, but not the whole thing. So I would ask you to go look at your vitamin C in terms of your multivitamins you have, vitamin C by itself, to be certain it's not ascorbic acid. Not the same thing. Vitamin C, the one I take, is this one, Garden of Life version of that. And I like it because it has some really good organic compounds in there. It has blackberry, blueberry, has spinach, strawberry, ginger, garlic, right? All of those really good things. And this one you have to kind of be careful with in terms of vitamin C, because it can also cause you some belly disorder, specifically diarrhea if you take too much. So I'd probably start low, 500 milligrams thereabouts, and go up if you need to. His protocol, I think, calls for 1,000 milligrams of vitamin C, which is really good. Vitamin D3 is the next one that he talks about, D3. And again, for this one, you may want to still get your levels checked to be certain that you're not too high already. Ideally, you want your target vitamin D level to be, per my thought, 80 to 100 nanograms per milliliter. It's what you need to target for yourself. Now, and I say that because there's some therapeutic benefits at the 80 to 100 nanograms per milliliter. So not just viral processes, but other things as well. Other things that seems to be increasing in the last couple of years. It helps with that as well. Some people would tell you, in fact, when you look at stuff from Google, it'll tell you that 30 nanograms per milliliter is normal. Right, basic, low level, very low level, normal. You want to be up in the therapeutic range, as I said before, 80 to 100 nanograms per milliliter. Also remember that when you take in vitamin D3, you want to couple that as well with K2, not in the Zelenko's protocol, but D3, when you take 500 units of vitamin D3, you may want to take about 100 micrograms of the K2. And again, those two work well together. The only thing I'd add to the protocol, Zelenko's protocol, is magnesium. Magnesium, again, is an activator of the vitamin D3 receptors. Has several, 300 plus other different enzymatic reactions in the system. I like L-Threonate for that reason. Helps with the activation of the D3 receptor, but also helps with several things like muscle relaxation, sleeping, blood pressure as well. So anyway, that's the Zelenko's protocol. I'll put a link in the bottom of this video, and you can see exactly how much he suggests you should take, especially in this time of year. Thanks for listening, Dr. Walker.